Congratulations on all the awardees. It's very inspirational of all the work that you do. I hope you'll inspire the next generation as well as us to work as hard as you do and achieve all the things that you've achieved. And I also want to say congratulations again to People for 25 years of incredible service. So this session is going to be on accreditation. And I'm going to give you a brief history and background on the accreditation activities that are going on in Ethiopia. Well, let me introduce myself while I'm doing that. My name is Dr. Lekki Taddese. I'm Associate Professor of Pathology at Howard University Hospital and College of Medicine. In my capacity here, I am representing People as the Vice President of Accreditation. I'll give you a brief history of how People got involved in accreditation in Ethiopia and what we're doing to support that effort. Dr. Annauga was reminding me right after the accreditation, actually, there was a cake ceremony because of the 25th anniversary. So they're getting ready to cut the cake. And really, the cake is representative of all the hard work they've done in the last 25 years. So we'll allow them to have that ceremony before we go on to the accreditation. Actually, while they're opening the cake up, my journey with People started as just an attendee at the conference. I used to come to the conference trying to figure out what the organization was all about, what they're doing, and I don't like to jump into things that I'm not familiar with, that I don't know and that I don't understand. But the one thing that hit me after about maybe the third or fourth conference that I attended was how the organization was very true to its mission. And so I believe in their mission, and I think 25 years of that has been incredible. So Dr. Annauga is inviting all the awardees to come up here in the cake cutting ceremony and to take part of that. So all of those of you who received the award, please come on up. My goodness, congratulations again. Okay, big round of applause for People. Congratulations. Okay, is the presentation up again? Okay. All right, so a little bit of an accreditation of universities and medical schools in Ethiopia. As an update, what we hope to do in this session is to sort of provide you information on universities and medical school accreditation that's going on in Ethiopia. The accrediting body who has the authority to accredit higher education is called the Ethiopian Training Authority. We'll hear from them about the progress of accreditation. We will hear progress of accreditation from medical schools. And we're also going to highlight the stakeholders that are involved in this process. And we'll take your questions and comments at the end. It's not advancing. You want to move it forward for me? Okay, very good. So benefits of accreditation for those of you who are in any kind of academic or higher education. Higher education and any academic is accredited all over the world to ensure quality. It's all about quality ensurement. It's a very effective quality improvement tool. It demonstrates commitment to the excellence by the part of the academic organizations. It encourages self-improvement. And hopefully the journey that we're taking, actually, we're even taking it all the way up to trying to get international recognition, and it also facilitates planning and implementation of change. It's a very, very, very powerful tool in my mind, really. So what is accreditation in Ethiopia? First of all, there is an authority that has been given a national mandate to accredit all higher education. That is called the Ethiopian Training Authority. And the way the Ethiopian Training Authority works, it's responsive to and works under the umbrella of the Ministry of Education. So those are the two big organizations that are responsible. So now who are the stakeholders when it comes to accreditation of medical schools? The two most important stakeholders are the Ministry of Health and the Ethiopian Medical Association, which work very closely with ETA. The job of ETA is to accredit all higher education, and in the context of medical education, that would be the medical schools. So what People has done is it has created a task force to support this process. So I'm going to tell you a little bit about that task force. So first of all, ETA, like I told you, is the organization that's responsible for accreditation. The medical schools are responsible for showing that they are in compliance with accreditation, that their education quality is sound. And the stakeholders, their role is collaboration, training, and support. And what we've done as an international organization through People to People is really to come and support that and provide technical expertise and training. Dr. Naugao and I had a conversation about supporting accreditation a couple of years, 3 or 4 years ago. And through that conversation, we decided to establish a task force that's going to support this process. And it was established by People to People. Dr. Naugao is the one who convened us in August of 2022. The members are all volunteers. And one of the most important things I want to highlight to you, why I respect this organization tremendously, is I believe in their mission. And their mission has been unwavering from day one. And as is stated in the magazine and that they've written it on their website, their mission is really to build a bridge linking the diaspora with the Ethiopian institutions for effective human resource development, healthcare, and education, okay? And nothing embodies this task force for me as making that a reality. That's one of the most important things about this mission, is how they take that mission and translate it to reality. So what's involved in this process? Number one, stakeholders and building a bridge, which is what the organization is very good at doing. And so as part of that bridge, very important stakeholders are part of that process, okay? As far as the task force is concerned, its role is really to assist in accreditation implementation, and by that process to improve medical education in Ethiopia. And the method we do that is by providing technical advice and training and support. So who are the members of the task force? Here's where that triangular partnership comes in. What does the triangular partnership involve? It involves Ethiopian institutions, it involves the diaspora, and involves American institutions, okay? So in Ethiopia, the Ethiopian Training Authority, Dr. Dunkwana and Ato Tarafa are the two members. Ministry of Health, Ato Assegid and Ato Mohammed. Ethiopian Medical Association, which is the professional organization that tremendously supports medical schools. Dr. Tagbar, Dr. Samuel, and Dr. Amal, who is our awardee here. She's the vice president. She was previously the dean. Not only was she the dean previously, she was the chair of the Council of Medical School Deans in Ethiopia, so she was part of our task force. And I want to say thank you to her because she's one of the most exemplary members. Can you imagine every other Saturday we met for 2 hours for over 2 years? And we're still meeting now. We're trying to get it to only once a month because we've killed ourselves. But she was the first person to come to the meeting, unwavering. She would be on a trip somewhere and she'd be at the airport and she'd still log in for the conversation. 2 hours every other Saturday. And in Ethiopia, usually the time is like 5, 6 p.m. So over dinner, okay? So commitment was very huge. From People to People, of course, Dr. Kabede, Dr. Abraham, Dr. Naugao, myself, and then Dr. Gananao, who is a professor of economics at Dubai University. So these are the members. Dr. Dawit, who was an accreditation commissioner of UAE, was a very important member of our group with a tremendous experience in accreditation. Unfortunately, he passed away last year unexpectedly. So in honor of him, who is a very valued member, I want to remember him. He had a tremendous contribution to our group. So having told you about a little bit of our task force, I want to have the panelists join us now to tell us a little bit about their own organization and their own journey into the accreditation process. So the first of our panelists is going to be Dr. Dunkwana Nagusa, and he is the Deputy Director General of Accreditation and Standardization at the Federal Democratic Republic of Ethiopia Training Authority. He has tremendous experience in accreditation as well as higher education. He was a high-level university official for many years, and now he's leading the effort to make accreditation. So I also want you to understand accreditation is new to Ethiopia. Okay, what do I mean by new? They have been doing what's known as quality audit to see if higher education is meeting standards, but the audits were just meant to encourage the schools to improve themselves. It had no bite to it. It had no decision-making to it. So the accreditation now will come with a decision whether a program can be accredited or not. And in the future, that means tied in with finances and tied in with their mere existence. So it's going to have a legal implication. And this is the first that is going to be implemented. So I think we're part of a historic process in Ethiopia. But he will tell us about the progress of the accreditation at the accrediting authority, which is ETA. That will be followed by Dr. Samuel Mangustu, who is the project manager of the Health Work Improvement Program at the Ethiopian Medical Association, a stalwart champion of the medical schools, and he's done a lot of work to try to get the medical schools to be ready for accreditation. So he'll tell us Ethiopian Medical Association's role as well as the progress of medical schools. The next speaker is going to be Ato Assegid Samuel, who is the Director of Human Resources Development at the Federal Ministry of Health. I think his title has changed now. Let me see. I think he's a lead executive officer, so he's been promoted. That was an older one. I apologize, Ato Assegid, if you're listening to me. Lead executive officer of Human Resource for Health Development and Improvement. The Ministry of Health, just like I have a lot of respect for the people-to-people organization being true to the mission, I also have a lot of respect for the Ministry of Health because it truly is an organization that works with its stakeholders. Okay, they're very wonderful in supporting medical education. They're involved in curricular development. They're involved in the health workforce development. Huge respect for how big a role the Ministry of Health plays in supporting medical schools. So he's a big champion of accreditation, and he'll tell us the role of the Ministry of Education. And then Dr. Gananao Warku, he is a associate professor of economics at University of Dubai. And his role is actually getting his own institution ready for accreditation. Okay, so he's done a lot of work for his own program, the business school program for accreditation. And not only that, as part of the task force, he was volunteered to develop an international collaboration with University of UAE Academic Commission for Accreditation, linking them with Ethiopia. So he'll give us an update on that. So I hope you get a flavor of what this whole stakeholder thing means. Who are the people that are playing a role, what the driving force behind people-to-people and the mission to get everybody together. Beautifully coming through this exemplary example. And I think we've done a lot of progress in the last 2 years. There's more work to be done, but it has been an incredibly successful journey because there are a lot of hardworking, committed, talented people in the task force, and we all share a common vision. So having said that, hopefully Dr. Dinkwana is on board. Ade, let me know if he's already logged on and he's ready to do his presentation. So if we could go to the panel of the group that has joined. Dr. Dinkwana will be our first speaker, giving us an update on the progress of accreditation at the Ethiopian Training Authority. Are they on? Are they logged on? Okay, all right, good. So we'll give them a few minutes to get started. So again, like I said, that commitment every other Saturday. In fact, I think Dr. Amal knows very well, I tend to be a hard driver when it comes to meetings. So I would send them meetings on like a holiday, I think Tumkat or whatever it is on whatever Saturday, like, where are you all? Why aren't you joining in? And they're like, it's a holiday. Okay, I apologize. And we've had a lot of heated discussions, as she said. One of the most important things we have to understand is it is important to work with people who have opposing views from you. We have to learn how to listen to each other, and we have to learn how to accept someone else's perspective that may be different than mine. So I think we've learned a lot of, thinking that maybe my way of thinking was the right way until I realized there's a different perspective to look at things. And I think this group has been incredibly wonderful because they're very vocal and very opinionated people in the group that really has propelled us forward in a wonderful way. So I hope, like I said, that exemplifies the mission of people to people, what we've been doing. And hopefully if Dr. Dinkwana can join soon. Oh, and I forgot to talk about Dr. Anogo. Good God. So Dr. Anogo is one of our panelists. He will tell us the role of people to people, what people to people has done, what he saw as his vision when he first started the task force, and we'll hear from him, as far as the people to people's contribution is concerned. So while we're getting Dr. Nkwana to come in to tell us about ETA, I want you to say something about your vision when you started this process, how you got the task force together, how you've seen it work over the years in terms of implementing accreditation, and like I said, how exemplary it is of the mission that you've started 25 years ago.
Thank you, Dr. Leki, and good afternoon again. So obviously, I think everybody appreciates the value of accreditation. So accreditation is about quality education, quality healthcare. And as we know, no country in the world has fully developed without quality education. So the issue was, how can we, as a product of education, and we are where we are because our people helped us. So the question is, how can we give back to our institution, to our people? And obviously, it was a natural, organic process to invest in accreditation. So it's also easy when you are fortunate and you have a vibrant leader with experience, with knowledge, like Dr. Leki. So Dr. Leki has been, like earlier, Professor Mangasha said, there was a strong tie between Howard University and Gondar University, taking the students and working also through the laboratory. So that foundation was there. So easy for me to tap that. And so last time, when Dr. Kabada, Dr. Anthony, myself, Dr. Abraham, when we went to Ethiopia, and we had also a very supportive health minister, Dr. Leah. So we had a meeting there, and they are also on board. They realize that quality education is also important, and they wanna champion it. So what happened was, we organized a webinar, and the webinar was coordinated by Deborah Marcos University. I think Bahadar University and Deborah Marcos University presidents were visiting here in the US. So while they were visiting here in the US, we had actually a webinar, and there was like a good panel discussion. And so Deborah Marcos University took the lead that when we went to Ethiopia, they would host that lecture, and it was organized by Ministry of Education. So the first lecture was given by Dr. Lekiderlo at Deborah Marcos University. It was launched in that fashion. And interestingly, Dr. Dawit apparently followed that discussion from Dubai, and he joined us immediately to be part of that program. So unfortunately, he's not with us. So the concept is, how can we improve our institutions' quality? And it's not only just like one time to get like accreditation, but a sustainable. So it's like a nation building for the future. So how can we instigate that into the higher education system, so the countries will produce very capable Ethiopians. It's not only in medicine, engineers. Earlier, like Dr. Brano, he's preparing to go to the moon, but he's a product of that country, I think. So it's really like Ethiopians, if given the opportunity, there is no limit to achieve. And so that has been really the hallmark of this accreditation program.
Thank you very much. And Dr. Amal, she joined the task force from the very beginning because, like I said, at that time, her role was as the Dean of Addis Ababa University. She was also the chair of the Council of Deans. So she represented the medical school. And then later on, when she became vice president of Ethiopian Medical Association, she's still part. So she's been from the very beginning. And I would like her to talk about her perspective of the task force, both for what the task force achieved, but also the progress of medical schools in trying to attain accreditation. Dr. Amal.
Thank you, Dr. Lucky. I think due to technology issues, I've become a panel member. I wasn't supposed to be one. Anyway, I think in terms of the Council of Medical Schools in Ethiopia, it was important for all deans to be on board and to understand what accreditation was and why we needed to be accredited. So at the beginning, I think there was a lot of confusion, a lot of difficulty understanding the process, and also somehow not being able to, envision that there was something that we needed to achieve and if it was even possible to achieve it. So there was initially the 2024 in January, ESFMG would no longer accept graduates from taking the USMLE exams or go to further education if they didn't come from an accredited school. So that put a lot of pressure for us from our students and our graduates because we needed to achieve that goal. And now they've kind of slowed down on things. So at the beginning, with that, the initial process was trying to get all medical schools involved and making sure that the leadership was also involved in these programs, because without the commitment of leadership, it was impossible to achieve these goals. So having said that, then we had to wait for the Education Training Authority, or ETA, to establish new guidelines and then implement those guidelines in order to do our work. So there was a lot of back and forth, a lot of ups and downs. And just when we think that we're going towards achieving that goal, there was some setbacks. But I think right now we're at a good track. All schools are on board, all deans and the leadership is on board, ETA is on board, and all the materials are available. So I think we're in the final stages of achieving that. So I think we've come a long way. I no longer represent the Council of Medical Schools in Ethiopia. So right now I'm talking as Vice President of the Ethiopian Medical Association. So the final updates will be given by Dr. Samuel. Thank you.
Thank you very much. Appreciate that. Dr. Dunkwana, if you can hear us. So Dr.
Yes.
Dunkwana is really the force behind accreditation. He is the most important person at the Ethiopian Training Authority who has really been the champion, doing all the work, getting ready for accreditation. So he'll give us a progress of where accreditation is going on at ETA. Dr. Dunkwana?
Thank you, Dr. Lucky. And I would like to thank people to people for giving me this opportunity to discuss about the progress of accreditation in Ethiopia. First of all, I would like to congratulate people to people who has served the community and the people for the last 25 years. It is a long journey, really. I'm very much happy to hear this also. And saying this, and I will start my discussion by thanking especially Dr. Nagao, Dr. Leki, Dr. Kabade, Dr. Gananau, and the late Dr. Dawit in assisting us to come to this point. And it is really clear that today assuring quality and discussing about quality of education and training is a big agenda. It is a global agenda. It is not only that of Ethiopia, and it's a global agenda too. And assuring quality has started 25 years ago in education and training system of Ethiopia. And at that time, it has started in registering especially private education college, university college and the universities to offer, to provide education at degree and the master's level. And HERCA was born at that time and mandated to assure the quality of the higher education system in Ethiopia. And in the last 20 plus years journey, HERCA has done a lot in giving permission to provide education, the training in higher education for college, university colleges and universities. And nowadays, there are about more than 350 colleges, university colleges and universities in Ethiopia offering degrees as private institutions. And we have started 23 years ago to audit institutions, these institutions, including public institutions too. And this has been for the last 20 years. And in the last 2 years, we have started to accredit institutions. So what we have done for the last 2 years is installing a system of accreditation in Ethiopian education and training system. So in that journey, we have met people to people, Dr. Nagao and Dr. Lucky, and they have assisted us because we are a novice to the accreditation of institution and the programs, even though we have a good experience in auditing institutions and their programs, but because of accreditation. So we have started by studying what is going on in the world and a different part of the world concerning accreditation. And we have studied carefully by selecting some institutions of the world, especially USA, UK, Europe, Asia, Africa. And we have studied seriously by selecting a few countries' experience. And we have developed standards because accreditation is process-based. And so the process should be seriously guided because it needs a lot of guidelines, working documents. We have to develop starting from guideline, and we have developed a guideline, and this guideline has to be approved by the board of ETA. And so in this journey, and Dr. Lucky has especially assisted us meticulously, really, and I would like to thank, because she has really contributed day and night in assisting us and training us and developing, editing the documents and providing training. And I remember we called her in the middle of the night. We're here in Ethiopia. It is daytime. So she really contributed a lot. And I would like to ask the conference to join me in applause for Dr. Lucky.
Thank you.
And saying so, nowadays, we have started by setting the documents, developing the documents from generic, and then we have moved to developing for specific programs such as health science and engineering programs, especially focusing on medicine, midwifery, anesthesia, nursing. Nowadays, and we have developed and approved the whole documents concerning to accredit, which are necessary to accredit institutions and programs. And it is required to develop about 13 documents to accredit one program. So you can imagine how much documents are required for different programs. And so far, we have developed for these 4 health science programs and engineering. And also we have introduced these standards and the work documents and provided training to institutions and their programs and at different times. Nowadays, to conduct accreditation, assessors are needed. We have already trained assessors for medicine program, the anesthesia, and the midwifery programs, and the others are in the progress. Nowadays, institutions are applying for accreditation. We have already received 3 medical school programs accreditation, and we have reviewed the documents submitted, and we have responded for the adjustment of some issues, especially the first standard, which is really important for us. And so our institutions have to design programs making outcome-based, because our policy dictates that the education in Ethiopia should be outcome-based. So nowadays, we have already reviewed 3 medical school programs, and we are ready to conduct, especially one of the medical schools, and we are processing the field visit. And these are some of the achievements so far we have worked, and I will discuss the detail if needed through question and answer. Thank you.
Thank you so much, Dr. Dunkwana. I cannot overemphasize to you how much work ETA has done to get to this point in system building. And like I said, he was the force behind it. So thank you for that update. And as you heard, they're well on their way to implementing accreditation, which is going to be a historic first for the country. So, incredible journey. The next person I had wanted to hear from was Dr. Atwas Saged. I don't think he is on. So we'll move on to Dr. Ganano. As I introduced him, Atwas Saged is there? Atwas Saged.
Yes, I can hear you.
Good. Okay, I'm introducing you,
Yes,
saying
I
that
can
what a
hear
wonderful
you.
organization the Ministry of Health is in terms of supporting its stakeholders, and the role that you guys have played from the very beginning, even before we started the task force in supporting accreditation. So, Atwas Saged, if you want to say something about your role on the task force, as well as the role of the Ministry of Health in terms of supporting accreditation.
Thank you so much, Dr. Lucky. Good afternoon, everyone. I would also like to congratulate P2P for the 25 years of impactful job in the health sector. Accreditation has been started. So all this conversation, especially when we talk about accreditation, has been started through the leadership of our former Minister, Her Excellency Dr. Lia, and the current Minister, Her Excellency Dr. Meglis, also pushing this agenda forward. So I would like to thank Dr. Leki, Dr. Naugao, and our former minister for setting the tone in accreditation in Ethiopia. So to make accreditation a reality in our sector in Ethiopia, we have actually started making the process very formal, because having formal notes are very important to move any agenda forward. So for that, we have actually signed a memorandum of understanding. So this memorandum of understanding, especially in the health sector, gives a good, era of partnership, which focuses, to improve health professionals training, accreditation of medical schools, and the introduction of USML in Ethiopia. So through this strategic alliance, our aim was, to fortify what we are doing to improve healthcare system in Ethiopia, ensuring of our medical professionals are equipped with the skills, knowledge, and accreditation necessary to meet the evolving needs of the ministry, as most of is to promote the health and well-being of societies through providing and regulating comprehensive package of health service of the highest possible quality in an equitable manner. So when we talk about quality of health service, one of the critical input is the workforce. So the workforce has to be competent enough to provide quality health service. So when we talk about quality of healthcare professionals, accreditation is one of the means. So that's why we are engaged in this important activity. So through the collaborative activities that we are doing with Ministry of Education, Ethiopian Training Authority, Ethiopian Medical Association, and other stakeholders. There are lots of activities have been done to improve. I have actually different roles, but I would like to talk some of the important roles we are playing to realize accreditation in Ethiopia. So one of the things is the ministry is working with Ministry of Education, including ETA, to define qualification requirements, especially the minimum educational and professional qualification requirements of various healthcare professional categories, including the medical doctors, nurses, pharmacists, and other healthcare professionals. So we are also working with different stakeholders, especially the professional associations, in collaborating how we can make the accreditation a reality in Ethiopia, because accreditation requires resource different kinds of expertise. So we are supporting professional associations to become capable enough to realize accreditation in Ethiopia. The other one, we are also collaborating with different other sectors to bring about the required expertise again to realize accreditation in Ethiopia. So the ministry is very interested in supporting the healthcare professionals' competencies. So we believe accreditation will bring one of the qualities that our healthcare professionals will acquire in their career development. So we are very happy collaborating with all of you in this special activity, and we will also strengthen our collaboration, our commitment to make accreditation reality in Ethiopia. Thank you.
Thank you so much, Ato Assegid. Like I said, Ministry of Health's accreditation is very exemplary. The other speaker that we're going to hear from is Dr. Ganano. He's an associate professor of economics and director of undergraduate studies at University of Dubai. He's a member of the task force. He prepares his organization for accreditation. And he volunteered on our task force committee to try and link an international organization so that best practices could be shared. So he's going to give us a little bit about that. Dr. Ganano.
Yes, thank you very much, Dr. Lucky. Can you hear me, I think?
Yes, very well.
Okay, great. Thank you, all of you. So what I'm going to do today is to brief you on our effort in terms of building international collaboration with international stakeholders here. So what we did was, so as Dr. Lucky mentioned, our job as task force is to assist the ETS efforts towards quality assurance. So because the whole idea is that quality assurance is not local, but it has an international reach. So what we did was, therefore, we tried to tap into international quality standards through collaboration with other stakeholders here. So what we did was, again, we contacted CAA. CAA is a counterpart for ETA in the United Arab Emirates. It's an equivalent organization to ETA in Ethiopia here. So communication was established. Again, Dr. Leke mentioned that Professor Dawit, the late Professor Dawit, was instrumental on that because he was one of the commissioners. And the CAA is led by a director and 15 commissioners, and one of them was Professor Dawit. So himself and myself tried to establish the link, and then we sent an invitation to the CAA. CAA was so excited, and we had a joint meeting on March 6, 2023. This was attended by Dr. Bainias, who was the director of CAA, and from our side also, His Excellency Ambassador Shifra has attended this meeting, including his deputy. Dr. Dunkwana was there, Dr. Leki, myself attended this meeting. And then it was a very welcoming meeting. We had a number of discussions, like we discussed on what are the best practices, how do we share best practice among the two parties, Accreditation, IT systems here. What can we learn from them, and then what they can learn from us. And also selection of team of assessors, training of team of assessors, including shadowing. We also talk about program readiness, and they were so excited on this collaboration here. So accordingly, now they are working on the MOUs between the two parties, CAA, which is a UAE part, and ETA from the Ethiopian part. So as soon as this MOU is signed, so we'll jump on the implementation part here. So in future, such collaboration is very important, because one of the things that I can share you in CAA, what CAA collaborated with a lot of international organizations. I think maybe most of you know the AACSB, which is the Association to Advanced College Schools of Collegiate Schools of Business. This is an American institution which works on accreditation. So they have already collaboration with them. And also ACPE is also the American part. They have also collaboration with that. ABIT, they have collaboration with that. Whatever you call international organization, they are working with them. So CA has really a very good experience in terms of quality assurance. So that was the reason that we have to really had the collaboration with this CA here. So I just want to thank you. And if there is any question, then I can collaborate. I can answer on those questions. Thank you, Dr. Laki.
Thank you, Dr. Ganano. Thank you for being the champion trying to set up this international collaboration. The last person we had wanted to hear from, I don't think he's logged on, is Dr. Samuel. I don't know if he's on, if you see him. He is, I think, the Human Workforce Development at the Ethiopian Medical Association. And the Ethiopian Medical Association is a very, very supportive association for medical schools. Dr. Amal is now the vice president. Dr. Tagabar is the president. They provide a lot of technical support and training to get the schools ready for accreditation. So I would have loved to hear his collaboration. But hopefully that would have given you a nutshell what the task force is doing. In fact, like I said, very exemplary of people-to-people's stakeholder partnership and bridge building. And like one of the awardees said, leaving a legacy and leaving an impact. So when accreditation becomes a reality in Ethiopia, we can say, you know, we had some role in it to support it. So if there are any questions from the audience that you would like to pose for us to answer to any of the panelists, feel free. I hope we've given you a flavor of the last 2 years worth of effort, and we're still working hard towards that journey. But if anybody has any questions or comments on either accreditation, or if you want to know this, you know, so far what made us successful in this task force, from what you've seen with all the wonderful people that are here. So we'll be happy to take any questions or comments. Okay, if no questions or comments, thank you very much for your time. Appreciate it. And we made up for lost time, so. Thank you for all the wonderful panelists. Thank you for joining from Ethiopia, Dr. Dunkwana. I appreciate it. Hope to see you very shortly in the next meeting. Dr. Ganano from United Arab Emirates, very international. Thank you very much for joining, and we'll see you soon at the meetings. Thank you.
Thank you very much.